Welcome to British Biomedicine Institute. Today we will explore emergency radiology and trauma imaging and radiodiagnosis. Spinal trauma is very frequent injury with different severity and prognosis varying from asymptomatic condition to temporary neurological dysfunction, focal deficit or fatal event. The major causes of spinal trauma are high and low energy fall, traffic accident, sport and blunt impact. The radiologist has a role of great responsibility to establish the presence or absence of lesions, to define the characteristics, to assess the prognostic, influence and therefore treatment. Quick and proper management of the patients with trauma, from diagnosis to therapy, can mean reduction of the neurological damage of vital importance for the future of the patient. The rationale of imaging in spinal trauma is to diagnose the traumatic abnormality and characterize the type of injury, to estimate the severity, potential spinal instability or damaged stability, to evaluate the state of the spinal cord and surrounding structures. X-ray is generally reserved for evaluating patients suspected of cervical spine injury and those with injuries of the thoracic and lumbar areas where suspicion of injury is low. CCT is strictly recommended in patients affected by blunt cerebrovascular injuries. Both lesions can be strictly correlated and generally contrast medium administration to exclude hemorrhagic brain lesion and cervical fracture is not needed. Even if MDCT is the first imaging modality in a patient with trauma, MRI is essential for the soft assessment of the ligament, muscle or spinal cord injury, spinal cord, disc, ligaments and neural elements, especially using T2-weighted sequences with fat suppression, or T2 short tau inversion recovery (STIR) sequence. MRI is also used to classify burst fracture, obtaining information about the status of the posterior ligamentous complex, a critical determinant of surgical indication even if the diagnosis of ligament injuries remains complex, and its grade is also underestimated, using high-field MRA. In the management of patients with polytrauma, MDCT total body scan is necessary in an emergency condition, and MRI whole spine indication is secondary to the clinical status of the patient, spinal cord compression syndrome. MRI has also an important role in case of discordance between clinical status and CT imaging. In the absence of vertebral fracture, patients can suffer from back pain resistant to medical therapy, owing to bone marrow traumatic edema that can be detected only using stir sequence on MRA. The management of spinal trauma remains complex. MDCT has a wide indication for bone evaluation in patients affected by severe trauma or patients with high risk of spine injury. MRI has major indication in case of spinal cord injury, in the absence of bone lesion. A relatively simple protocol can be used for patients with blunt trauma, based on scanning the entire abdomen in the portal venous phase and a subsequent delayed excretory scan 3-5 minutes later if injury is detected on the initial scan. Thank you for showing interest in British Biomedicine Institute Skilled Nano-Degree Program. Hope you have gained a lot of clinical information through this presentation. Please share, like, and subscribe British Biomedicine Institute channel. Good luck.